So this one's going to be the valgus stress test for the MCL. So I'm going to have my right hand or my one hand down here over the medial malleolus, my opposite hand over the LCL. Start them at 0 degrees, and I'm going to put a valgus stress. Then I'm going to take them to 30 degrees and do a valgus stress. This one we're going to isolate the MCL at 30 degrees. That's the valgus stress test. This is the varus stress test. So I'm going to have the bottom hand on the lateral malleolus. I have my opposite hand over here at the MCL. I'm going to take her to 0 degrees. And I'm going to go ahead and do a varus stress. Then I'm going to take her to 30 degrees. And I'm going to place another varus stress. And here I'm isolating the LCL. This is going to be positive if there's pain and or laxity. This is the varus stress test. Okay, the next one is going to be the anterior drawer, which tests the ACL. So I'm going to put her just about 90 degrees. Go ahead and sit on her foot. First thing I'm going to do is I'm going to feel to make sure that the hamstrings are relaxed. Then I'm going to place my fingers right here on the tibial plateau. Once I got a good grip, I'm going to go ahead and slide it forward. And I'm looking for laxity. So I'm going to see if the tibia slides forward. And that's the anterior drawer test. Okay, the next one is the posterior drawer test. So much like the anterior drawer, I'm going to sit on the foot. I'm going to go ahead and find the tibial plateau. But instead of pulling anteriorly, I'm going to push backwards, so I'm going to push posteriorly. As I do this, I'm going to rub my fingers right across this joint area, and I'm going to see if the tibial plateau is sitting backwards, and so it'll feel like it's a flat surface on this one. This is the posterior drawer test. Okay, first thing we're going to do is we're going to find the joint line with our fingers, take our hand off the patella, gripping the tib fib. Take them in flexion, so internal, external rotation, and we'll go valgus, external rotation, and slide it out. One more time. Then we're going to go varus, internal rotation, and then take them out into extension. Again. And that's a McMurray's test. Okay, we're going to go ahead and take them into 90 degrees. We're going to put pressure over the heel. As I press down, I'm going to externally and internally rotate the foot. What we're looking for here is we're looking for pain, and that's positive for a meniscus tear. This is the Apley's compression test. Okay. Alright, the next one is going to be the patella apprehension test. This one, what we're doing is we're going to reproduce the injury. So I'm going to take the medial border of the patella, and I'm going to push laterally. And what I'm looking for here is pain. So this test for subluxation of the patella. Okay, this is the patellofemoral grind test. This is testing for patellofemoral pain syndrome. So the first thing I'm going to do is I'm going to go ahead and place the stress right down on her quadriceps and then have her tighten up. And then she's going to relax. Move halfway down, same thing. And then relax. And then right behind her kneecap, tighten up. What I'm looking for here is pain as she tightens up and the patella starts to grind along the, we're testing the cartilage underneath. And this is the patellofemoral grind test.